Good afternoon, everyone. So I'm Lisa Holland, working with Fresh and Balance.
And I'm Becca Scott. I'm the strategic lead for public health prevention in maternity across the North East North Cumbria ICS. I also lead on smoke-free pregnancies as well, with my background as being a midwife and a health visitor.
So we'd like to explore with you today the question around, is secondhand smoke still an important issue? What we'll cover in our presentation is around the definition of secondhand smoke, the scale of the harm, how best to address this, and a call to action for everyone here today. So just a reminder, secondhand smoke is made up of two different types of smoke. So we've got the mainstream smoke, which is breathed in and out by a smoker, and side stream smoke from the burning tip of a cigarette. We know that secondhand smoke, 85% of this is invisible and odourless, and the inhaled side stream smoke actually contains over 5,000 chemicals, 69 of which are cancer causing. So there is no safe level of exposure to tobacco smoke, and we know that it is most deadly in that enclosed indoor environment. The good news is we have the most robust evidence base of how to address and reduce the harmful exposure of secondhand smoke, and we've already heard a lot today around the key pieces of legislation that we have in place to protect us from that exposure to secondhand smoke. We have the Smoke-Free Law 2007, and this is monumental, and everyone in this room would have probably had a part or have been around when this happened, and we achieved this through the advocacy and the leadership in the North East. We had one voice, and that was that secondhand smoke kills, and we had this through the needed, wanted, workable messages, and I think these are still very much alive today for everyone to take on board. The other piece of legislation is through the Children and Families Act 2014, and this is around making it an offence to smoke in a private vehicle with anyone under the age of 18. And I did want to note that this originated from a private member's bill by Alex Cunningham, our MP for Stockton North. So these two bits of legislation are vital in terms of protection. We still need to enforce them, and we still need to promote them in terms of compliance and also education and awareness for why these exist. So now focusing on indoor exposure, we know that this actually affects all age groups and not just children and the most vulnerable. And I just wanted to go back and remind ourselves from those estimated deaths back in 2005 reported by the BMJ around exposure to secondhand smoke in that domestic setting. We also had the RCP report in 2010 that estimated around 2 million children in the UK were estimated to be exposed to tobacco smoke in their home. And whilst there has been improvements to this, we have still got real concerns, and this is still a major health hazard for children and all age groups. We've heard concerns today as well around that inequalities and about the impact of COVID, and this has been shared in terms of our concerns, particularly around lockdown and exposure. So we've had concerns shared by our colleagues in Ash, who have great leadership around that exposure and secondhand smoke, but also from our own independent evaluations across the North East and North Cumbria, where we had smokers, over half of smokers, saying that they were actually smoking in the home when others were around, and 28% of that was on a daily basis, and that was around both adult non-smokers, but also around 10% where children were present as well. So the latest surveys data is putting us where frequent exposure levels at around 10 to 12% for children. This is still too high and needs to be addressed. Thinking about the health inequalities, people of the North East are disproportionately affected by the substantial health and economic effects caused by smoking. I'd like to acknowledge the leadership from Ash and shine a spotlight on smoking in the home, and the publications of their two reports have given us a really valuable tool to engage with our social housing providers to consider how we bring them in to the tobacco agenda and thinking about reducing some of those health inequalities. And it was very refreshing to hear Dr. Sharon Cox talking about some of this today and talking about those social housing and the challenges that we have around homelessness. We know that children who live with someone who smokes are 3 times more likely to become smokers themselves. So again, that exacerbates those inequalities. And whilst we've seen a decline in exposure to second-hand smoke over the years, we do know that children in rented accommodation still suffer more acutely from this exposure. So we have got this still going on now, and this is what we need to kind of focus our attentions on and think about how we can address this as partners. The good news is we have the evidence. We know how to use this, and we've got very effective things in our tools to be able to engage, to communicate, to educate, and to bring people along with us. I wanted to just show this montage today because this is the work that we can build upon as partners here today. We know that with TV, population level, it builds that awareness. We also know that at that locality level, we can have a communication tool, one message, one voice, but it's about that call to action in terms of take it outside. There is no safe level of exposure, and it's brilliant when we're talking about collaboration. We've got campaigns that we've co-produced with colleagues in the North West. We had the Scottish Government giving us their creative for our second-hand smokers poison campaign, and we've got those things that we co-produce with localities as well. So we really want to work with you on this platform and really see where we can take this going forward. We have a framework to succeed. It is very much at the heart of the Fresh programme in terms of second-hand smoke. From that very first inception and launch of the Fresh programme, we know what we need to do. There's comprehensive 8 key strand approach to this, and we really hope that this is a valuable tool for you to use both at a regional level and locally as well. Thank you.
So, as we've heard from Lisa, that this isn't just second-hand smoke, let's think about children, but it's right across society. It touches nearly everybody. And actually my own personal experience is, yes, just like Peter, I'm not a smoker, but I am actually a child of a smoker. And the impact of that for the child there and then lifelong is harmful, really, really harmful. So I don't think there'll be anyone in this room where they're untouched because our smoking rates have been so high. My specialism is around maternity and early years, and we know that tobacco dependency in pregnancy is the main modifiable factor to improve health outcomes for that unborn baby, particularly when we're thinking about neonatal admission, miscarriage, stillbirth, and preterm and low birth weight and the lifelong impact of that. So we know that we can make a difference. We still have over 3,200 babies born every single year in the North East and North Cumbria to women who continue to smoke in pregnancy. And what we must remember is that these women are tobacco dependent. They know the risks. We've got fantastic media campaigns, but they still continue to smoke, and they do need that support. Of the babies that are born, we know from national data that around 20 to 25% of those babies will need neonatal care. I'll come to the costings of that in a moment, but that's not nice for anybody. But where smoking has been a risk factor in that, we need to be doing more. So the last count back in 2019, I have tried to get more recent data, there was 4,602 babies in the North East and North Cumbria that had neonatal care and stayed in that unit. We know that women who smoke, those babies, even if she quits in pregnancy, there's a chance that the woman will start again after pregnancy as a choice, and those babies will continue to be exposed to harmful second-hand smoke. So the poor health outcomes that we know about, as you can see on the screen, it's around 20 to 50% will have low respiratory tract infections. 30 to 70% they have a wheeze. Up to 85% instance of asthma of a child who's exposed to passive smoking. Middle ear infections are quite significant as well, and anyone who's had to look after a little one with ear ache, it's not pleasant, but these are all preventable. There's much more chance of bacterial meningitis in under 5-year-olds, and the one for me, the one that really hits home, having to have cared for women who have lost children is the 1 in 5 sudden infant death. It's preventable, it's modifiable, so we must pass those messages on. It's part of our NMC for those that are registered, and we do need to share the risks. And I think that covers right across healthcare, not just maternity, which I'm much more familiar with. So when we're thinking about the impact on the baby when it's born and the child, we try to look at the data. Now, this wasn't easy at all. So again, this is a gap. We've got a gap in the North East and North Cumbria around data, which we're working incredibly hard on as a system to really improve. And Harrogate were really forthcoming from the Trust to share some data with us. And they do collect the data around children that are living with a household smoker. And that's quite significant at 27.7%. So that's covering 7 of our 12 local authority areas in the North East and North Cumbria. 17.7% of those families were provided with very brief advice where the smoker was present. So again, as well as tightening the data up, there's something there about can we do more in this space. There's indirect harm suffered by the families, so poverty, when your parent will put the cost of a cigarette packet above what you need, and it's not through a real choice, they are addicted. Parents sometimes can't work because of the ill health, because of tobacco use, and grandparents are also not able to help because they're unwell, or potentially they're just not around because we know that smokers are, they don't live as long and as healthy. So when we think about the economic cost of second-hand smoke, in the North East and North Cumbria, we know maternity services alone could save 1.9 million every year just by getting the smoking at time of delivery down to 5%. And if you think of the state of our NHS, where we're really trying to save money, there's no better place to invest, because this could make a big difference. Same with neonatal services. So if we say 20 to 25% of those neonatal admissions is because the parents potentially smoking, that's anything from 1.6 to 20.7 million in neonatal services. Looking more widely at what we could see was available, so in the UK, asthma drugs for children under the age of 16, that's 4 million. Discounted. 9.7 million primary care costs for treating children with asthma, and 12.1 million every year in the hospitals across England for admitting a child with asthma. They're big numbers. Let's bring it back down to the family. If you've got a baby in a neonatal unit, so it's quite likely if you're a smoker, that's going to cost that family £405 on average every single week. These families are generally deprived families. We must do more to prevent this. We have been working really hard, particularly in the North East and North Cumbria. We've come together as a system, and we do have a really clear pathway of care, which launched back in 2019. And with the long-term plan, that's really strengthened. That is having a really good impact. And back in 2021, it was welcome to extend that into the postnatal period. So really thinking about those children that are in the mandated services, such as health visiting, thinking about what can we do realistically when we're having these mandated contacts. So as an agreement that would continue the pathway, we would robustly identify these parents and offer them support into the local stop smoking service. There's no reason why we can't expand that further and do more. Paediatric services, asthma services for children, community clinics, family hubs, there's lots. It's not exclusive. What we need to do when we do that is make sure that we have got equipment available, such as carbon monoxide monitors, freely accessible NRT, prioritise these families for support. We know if a pregnant woman quits smoking, she's 67% more likely to quit with the help of a partner. So why can't we extend that a little bit further if it's not the partner that's smoking, but it's perhaps the parent or the grandparent? Access to digital materials, we've got to keep moving with the times. and really thinking about the data side. Where can we monitor it, and have we really got good quality, robust data? Do you want to come in on this one?
So I think when we're both now trying to wrap up the presentation, we want to think about some calls to action that we want to think about and what we'd like to get you involved with as well, and think about our commitments for the day. Is that when we're thinking about secondhand smoke exposure, it is in that indoor setting, and as we've already heard today, we need to have that balanced approach. And around things like outdoor spaces, we need people to be accessing outdoor spaces when we're looking at things like physical activity, mental health and well-being. So we need to be very proportionate around some of this when we're looking at the measures that we take locally. And that smoke-free public outdoor places, this will happen more as smoking rates decline and those social norms change. So there's something about that, about this sense of what approach we do start to take as a region and locally as we're driving this forward. Also harm reduction, we've heard about NRT and the role of vaping. Reducing exposure in that domestic setting, it's incredibly important that we look at the affordability and accessibility of that, but also widening out that the partners that can help us promote that harm reduction, and obviously things like the social housing providers and other local providers on the ground that can really support the third sector that's already been name checked today as well. Media and comms, we've got the evidence base, we know we need health harms, clear messages, take it outside. You know, there's still too many people being exposed. We need that one message and many messengers again. Regulation, Catherine's already presented on the regulation that we have. We've got the 2 laws in place, but is there an opportunity to advocate to extend regulation further if we're thinking about private vehicles and that protection for all ages? These are all the things that we can explore and think about together today as a partnership.
Yeah, and just to finish off, I think coming from the perspective of maternity and in the NHS, all of this is really important. Without all of this, we will not get the rates of smoking in pregnancy down. So I was talking to you both earlier on. It's incredible what you're doing, because we're reducing the smoking rate across the population, which will have an impact on these families. And eventually we will eradicate it. So just to finish, we urge, if anyone was listening, we need a properly funded tobacco control plan, please. And we need strong leadership. Everyone in the room today, you've got a massive role in this. We've got to continue to follow the evidence base. This is the only way we're going to get down to that 5%, and then we can go much further. I want us to protect our future generations. It's imperative of what we're doing. So my question to you today is that what will you do today to support this agenda? Thank you.